Hi. So our next topic is episcleritis. We dealt with scleritis. Now our next topic is episcleritis. So what is episcleritis? So episcleritis is a benign recurrent inflammation of the episclera involving the overlying tenens capsule but not the underlying sclera. So we while taking scleritis, I mentioned about the anatomy of sclera, right? So in that, the outermost layer is episclera, and next comes the sclera proper, and the last one is lamina fusca. So episcleritis is a benign recurrent inflammation of episclera. So the outermost layer of sclera, that is episclera, involving the overlying tenens capsule. At that time I mentioned all the sclera is covered by a lining, that is tenens capsule. It's a membrane like structure, tenens capsule. So here in episcleritis, this overlying tenens capsule is also involved but not the underlying sclera proper. It typically affects the young adults, being twice as common in women than men. So it is also common in women. So episcleritis is the recurrent inflammation of episclera along with the overlying tenens capsule, and it is mostly affects in young adults, and also it's common in women. So this is the picture of episcleritis. This is how the episcleritis looks. Next comes the causes. Causes of episcleritis, it's unknown. It's not known. It is found in association with gout, rosacea and psoriasis. Along with all this condition, there is a episcleritis. It has also been considered a hypersensitivity reaction to endogenous tubercular or streptococcal toxins. So this is it is also considered as a hypersensitivity reaction to endogenous tubercular or streptococcal toxins. It's like systemic, due to some other disease affecting in other part of the body, there is a secretion of toxins to the blood, and through the blood it will reach the eye and it will cause hypersensitivity in episclera, and then it will cause episcleritis. Like that, there is a chance of getting episcleritis. So exact etiology is not known. It is associated with gout, rosacea and psoriasis, and also it is considered as a hypersensitivity reaction to endogenous toxins like tubercular or streptococcal toxins. There is a chance of getting episcleritis due to these toxins. Pathology. Histologically, there occurs localized lymphocytic infiltration of episcleral tissue. So, there is an infiltration of lymphocytes into the episcleral tissue associated with edema, congestion of overlying tenens capsule and conjunctiva. So, pathology, they are telling there is a infiltration of lymphocytes into the episclera, and that will lead to edema and congestion of overlying tenens capsule and conjunctiva also. So this is a pathology of episcleritis. Clinical pictures. Symptoms. The episcleritis is characterized by redness, mild ocular discomfort described as gritty, burning or foreign body sensation. Many a time it may not be accompanied by any discomfort at all, and rarely mild photophobia and lacrimation may occur. So there will be redness like we saw in that picture. It will be in quadrant or in the anterior part of the episclera. Mild ocular discomfort will be there, burning or foreign body sensation will be there, and rarely mild photophobia and lacrimation may also present. These are the symptoms. Signs of episcleritis. On examination, two clinical types of episcleritis can be seen: diffuse or simple episcleritis and nodular may be recognized. So two types of episcleritis are there. Diffused, it can be seen diffused in all parts of episclera, or nodular, you can see along with a nodule. Episclera is seen acutely inflamed in the involved area. So that involved area is acutely inflamed. That first one is diffuse episcleritis. So here you can see the blood vessels are diffused and it's inflamed in the episcleral part. So in diffuse episcleritis, although whole eye may be involved to some extent, the maximum inflammation is confirmed to 1 or 2 quadrants. Here in diffuse episcleritis, almost whole eye will be may be involved, but the maximum inflammation is confirmed to 1 or 2 quadrants of the eye. In nodular episcleritis, a pink or purple flat nodule surrounded by injection is seen, usually situated 2 to 3 mm away from the limbus. The nodule is firm, tender, and the overlying conjunctiva moves freely. So this is nodular episcleritis. So you can see diffused in a diffuse episcleritis, and you can see a nodule surrounded by injection, surrounded by congestion of blood vessels, and it is near to this nodule is present 2 to 3 mm away from the limbus, and this nodule is firm and tender, and this overlying conjunctiva moves freely over this nodule. So these are the types of episcleritis: diffuse episcleritis and nodular episcleritis. Next comes the clinical course. Episcleritis runs a limited course of 10 days to 3 weeks. It will remain for 10 days, or it can extend to till 3 weeks, and it resolves spontaneously. However, recurrence are common and tend to occur in bouts. So there is a chance of recurrence. It will appear for 10 days, then it will go after 1 month or 2 months. Again, it can appear. It will be like that. Rarely a fleeting type of disease, episcleritis periodica, may occur. In a particular time period, it can occur within 1 month. Again, it will come in another 1 month, like that. This fleeting type of disease, that is episcleritis periodica. So this is the clinical course. So it can extend from the episcleritis can remain for 10 days, or it can extend till 3 weeks, and it will spontaneously resolve by itself. And there is a chance of recurrence, and also episcleritis periodica, that is a fleeting type of disease, may also occur. So this is the differential diagnosis. So differential diagnosis of episcleritis is inflamed pincicula. So pincicula we learned in the last class. So inflamed pincicula can be confused with which type of nodular type of episcleritis. So in that, inflamed pincicula can get confused. Swelling and congestion due to foreign body lodged in bulbar conjunctiva. In bulbar conjunctiva, if some foreign body is lodged, there will be swelling and congestion of the conjunctiva. So that will get confused with episcleritis, very rarely with the scleritis. Treatment: topical corticosteroid eye drops instilled 2 to 3 hours. Render the eye more comfortable and resolve the episcleritis within a few days. So we can instill topical corticosteroids. And cold compress applied to the closed lids may offer symptomatic relief. So for symptomatic relief with the ocular discomfort, if episcleritis is with ocular discomfort, if you give cold compressed over a closed eye, then it will be good. So this is the treatment for episcleritis. So also they are given systemic non-steroidal anti-inflammatory drugs. So first steroid eye drops can be given, then cold compress can be given, then internally systemic non-steroidal anti-inflammatory drugs can be given. So these are the treatments of episcleritis. So hope you understood episcleritis too. So it's a small disease compared to scleritis. So here also 2 types of episcleritis are there: diffuse and nodular episcleritis. And mostly the etiology, the cause for episcleritis are unknown. It's commonly associated with psoriasis, rosacea, gout and all. Okay, so mainly it is mentioned as hypersensitivity reaction towards some toxins. Thank you. Hope you understood.